Welcome to Stand Against Racism. Our first presentation on racism as a public health crisis is an overview by Dr. Ruby Mendenhall.
Hi, everyone. My name is Ruby Mendenhall, and I am an Associate Professor in Sociology and African American Studies. And then I'm also the Assistant Dean at the College of Medicine. And welcome to the WYCA's 2021 Stand Against Racism. And my talk today will be the Third Reconstruction and Renaissance, addressing racism as a health crisis. And as always, I want to thank our essential workers for the work that they do to put food on our table and to take care of our elders. And as Dr. King says, my hope is that they will also experience economic dignity, which is higher pay. And I also want to send out care to the families who experienced a loss during the several mass shootings in the US and Illinois, Georgia, Colorado, and other areas. And just a few points that I want to make today, both about the history and consequences of racism. I'm talking about the Third Reconstruction around equity and policies, and then also Renaissance, thinking about community healing and joy. So I showed this picture because it has my grandmother, and this is Selma, but she's from Camden, Alabama, and with Dr. King. And this is a very dangerous moment for all of them. Before this talk, Dr. King received a threat that they were going to bomb the church that he was going to speak in. And this was after, several years after the bombing of the church when the little 4 girls were killed. And then also here is a picture of my great aunt who took care, she's my grandmother's sister, and she took care of her grandmother when she was a child, and her grandmother was enslaved, who is my great grandmother. And I talk about that because my great aunt told me some of the stories from my great great grandmother, and it just shows how recent slavery is in US history, that there's only one person between an enslaved human telling their stories. And then this image is speaking to this idea of the first Reconstruction, right? Frederick Douglass was asked to speak at a 4th of July celebration, and his speech was basically, what to the slave is the 4th of July? Why am I here? Do you mean to mock me? And that's a quote at the bottom, and he talked about a fraud, and it is not light that is needed, but fire, and talking about the amount of energy, the amount of force that would be needed to change society from a society of slavery to a society of free individuals. And so when Frederick Douglass went to President Lincoln's address, and he was back at the White House, and President Lincoln asked him what he thought about it. And he said, I think you're doing sacred work. And to me, I think about it as this idea of he would be over, or at least Douglass thought at the time, this transition of enslaved individuals who are seen as property to humans. And then when you think about the Second Reconstruction, you think about it starting with the Brown versus Board of Education and on through the Civil Rights era that in some ways dismantled some aspects of Jim Crow, and I'm kind of hesitating, right, because of the great level of segregation and other things in this country. But Dr. King talked about how emancipation came as a joyous daybreak to end slavery, but 100 years later, the Negro was not free. And he talked about coming today to dramatize the shameful conditions of Blacks and other groups in the US. And he talks about, instead of honoring the sacred obligation, America has given the Negro people a bad check, a check which has come back marked insufficient funds. And so this is how those insufficient funds, this is the brutality in many ways of racism. Here's a chart of social, that talks about social determinants of health, where you have at the top what people come into the doctor's office complaining about, right? Stroke, diabetes, pregnant women who are experiencing stress, but and also high rates of infant mortality and maternal mortality. But underneath that are all the things driving it. Lack of quality education, the built environment that has toxins, segregation that limits access to living wage jobs, discrimination, economic insecurity, all of that driving the health disparities that we see, and showing how racism determines where you live, learn, work, or play, and how those have deadly consequences. And so in terms of deadly consequences, this kind of picture shows David Satcher's, kind of symbolizes his research, where he found that there were 83,000 excess Black deaths a year. So meaning more deaths than what you would expect from old age or from people getting sick. And he talked about this in, or they talked about it in the documentary, Unnatural Causes, Is Inequality Making Us Sick? As the equivalent as a plane full of African Americans falling out the sky every day, every year. And then Rodriguez and colleagues, they looked at the number of excess deaths from 1970 to 2004, and they came up with 2.7 million excess Black deaths. And so just imagine all of these planes falling to the ground with African Americans. And of course, COVID-19 has sped up that. And so we're witnessing the consequences of this as well. And I talked about the infant mortality. African Americans have a 2.3 times the rate of infant mortality as white individuals. African American infants are 4 times, it's like almost 4 times as likely to die from complications related to low birth rate as compared to non-Hispanic white infants. And then we're also seeing with COVID-19 that there are these lingering effects of the disease, and what does that mean in terms of African Americans and other groups having higher rates of the disease, and what will that mean in the long term? And here it's some consequences of police violence. So in this, I won't show the clip, but it's a clip about Stephon Clark's aunt. He was killed by a policeman, and his brother was in the courtroom and jumped on the desk and, you know, was just kind of very upset, and people were commenting. And in the clip, she talks about that, you know, our children who may seem as though they look like, you know, they're out of their minds, and she's saying what you're seeing is the trauma, and ask like, where are the community health resources in our neighborhood? And then this is also just an image of Charisma, who was a part of our documentary, What's Left Behind, and just kind of talking about losing a child. Her son was an adult, and that they used to share meals. And she talked about how after he passed away, she was had trouble tasting her food, and just kind of the grief and what it did physically to her. And understanding trauma, grief, all of that, and how it affects individuals is really key. Here is a graphic by the medical students here, Samantha and Kanisha, and it's a draft. They always want me to say this, but we put it together to try to illustrate when children experience adverse childhood experiences, that it has implications for their health and well-being later in life. And so for my research, about 57% of the families struggle with trying to have enough money to make ends meet. The mothers talked about this when they were children. That was their struggle. They talked about 22% of them were sexually abused or molested. About 41% reported seeing their, as a child, witnessing someone being shot, right? So that's an extraordinary high number. Some of them even talked about how they didn't tell their parents. And then again, almost 40% experienced the death of a parent during their childhood. So again, all those listed as trauma, and then how later they can play out in terms of the stress and the wear and tear on their bodies. And so we also created, the medical students also created this image to just kind of show what it means to be typically, right, you're at rest and then something happens and you go up and then you come back down. But because of racial trauma and other forms of oppression, many people are already on the revved up level. And again, that leads to overtaxing their immune system and other systems in the body. And so recently, more and more attention is being paid to this. And so recently the CDC director declared racism a serious public health threat. And Laurel, from NPR talks about racism is a scourge in American society, right? And then talks about it also as a serious threat. And then research that we recently published shows that subjective experiences or feeling that your children aren't safe, that you aren't safe, has implications for the immune system. And again, kind of this wear and tear that occurs. And so that's the point that I'm making in terms of the need for third reconstruction, right, in this moment. And it's a very powerful and sad in many ways moment with the deaths of Ahmaud Arbery, Breonna Taylor, George Floyd, and even recently, as yesterday, Dante Wright. And this powerful movement in our society that's saying it's enough and no more. And so I argue that as we have our first Black, Indian, female vice president and possibly future president in 2025 or 2029, that it is now the time to think about a third reconstruction. And I do want to acknowledge Barbara kind of has a book, and he's thought about this, him and his co-author. And so when I think about third reconstruction, I'm thinking about this idea of shift, of change on all these levels. And I was at a computer science workshop, and I love the analogy that someone said. They talked about, you think about social change as someone applying pressure to a ball, and then once that pressure is released, the ball goes back to its same shape. But we want to think about creating a new society, creating new shapes, so that you don't need the pressure to continue, that the wellness, the healing, the equity, that it's inherent in the society across all these levels. And one kind of person to really think about it, the more and more that I hear about Frances Perkins' story. She was the first female Secretary of Labor and worked a lot on the New Deal, which was not perfect, especially regarding people of color, agricultural workers, and others. But some of the things that it did bring forth dramatically changed American society, from the Social Security Act to other policies, and it was wide sweeping. She kind of spearheaded policies to help farmers, immigrants, Black women who were migrating from the South, residents in Chicago slums, those who were doing child labor, the elderly, unemployed, the uninsured. And so I think it's time to think about these broad sweeping policy changes as part of a third reconstruction. And then just a couple, definitely guaranteed income there. We're seeing the stimulus checks. We're seeing people really being thoughtful about the earned income tax credit and how can we expand it and what can be done. And then also I want to put forth this idea of a core of community health workers, of individuals who are embedded in the community who can help people deal with COVID, but also the stress of racial trauma. And we would see that in this idea of convergent science, right? Interdisciplinary science that involves physicians, that involves designers, engineers, individuals from the community, and putting together to create this new knowledge around health and wellness. What does it look like? And then innovation, right? If you know what's needed and if it's not here, then how do we innovate? How do we create spaces for individuals, especially those in the community, to share their knowledge, to share what works, to share what's been passed down from generation to generation in terms of coping, and how can you package that into a society that, as the Robert Wood Johnson says, is a culture of health, or creates a culture of health. And part of that is for young people to be able to thrive. We often like to celebrate the rose that's growing out of concrete, but I argue if the potential is a rose bush, then that's what we need to create. That's what we need to facilitate. And part of this, this renaissance, this kind of idea of what's possible, as I said in the earlier, the clip that I didn't show, but when she said, where are the community health centers, where are those resources? And this is one that we created as part of STEM Illinois, a public engagement project. And this physical space is in Lincoln Square Mall. And then also we created webcasts, right? So part of this kind of sharing knowledge back and forth. We've had Pamela Jolly come and talk about intergenerational wealth. We had young people there to ask questions. We've had webcasts about how to become physicians, because again, we need people who have this expertise. Everyone needs to have an expertise around their health and wellness, and we're trying to facilitate that. And then again, with this innovation, like where can people go to have their ideas heard, but then also to receive resources to create those ideas. And one thing that we have at the College of Medicine is a health makeathon, where anybody in the state of Illinois can submit an idea around health or wellness. And we select 10 winners who get a coin for $10,000 worth of resources to create their ideas. And as you can see from this picture that I love, we've had people as young as 4th graders submit to the Makeathon. And then, as I said before, I think it's really important to think about how can we democratize health information? How can we get it out into the community in ways that everyone has access to it? And so this idea of training community health workers, and that they will get information about neuroscience, about genomics. Karen Sims in town does a wonderful psychological first aid training, a psychological recovery training. And again, as I mentioned, cultural practices that people do already, how can we incorporate that into the toolkit of community health workers? And I love the book, How Healing Works, because it does talk about some of those cultural practices. And then there have been studies to see why those cultural practices indeed do work. And I argue that that information needs to be out in the community. And then we're training, getting ready to train young people, middle school, high school students. We were trained by Morehouse College of Medicine, and their bold, audacious goal is to have all youth trained as community health workers. And I told them we'll stand with them in that goal, so I keep saying it over and over for them. But just kind of thinking about, as we work with young people, how can we help them with information about health and wellness, from the importance of nature to the importance of moving, to giving gifts. For one of my classes, we created these treasure boxes for mothers who were experiencing stress in Chicago. And one of the mothers said, you know, I usually don't take time to do self-care or take time for myself, but since I know that the students put a lot of effort into these treasure boxes, I'm taking the time to use some of the things that they put in, the candles, the journey, the journaling, and other things. And she talked about how it did improve her mood. And so those are just some ideas as we talk about in this moment that continues with new events around racial trauma. What do we do? What can be done? And I'm arguing for a third Reconstruction and a Renaissance. Thank you very much for joining me.